Welcome everybody to the January 28th meeting for the Sea to Sky Regional Hospital District. I'd like to recognize that we're meeting today on the traditional unceded territory of the Lillooet Nation. Before we approve the agenda, I'm going to ask that we actually amend it so that we address item 8.2, which is the staff report and direction request, prior to item 7, which is bylaws. So we'll just amend the order of the agenda a little bit if folks are okay with that. And if that's okay, I see move to approve the amended agenda, moved by Director Ford, seconded by Director Mack. Any opposed? Motion carries. We do not have a closed meeting today. We don't have anything to rise and report. We do have one item on our consent agenda, which is minutes from the previous meeting, moved by Director Richmond, seconded by Director Pettingill. Any comments? Any opposed? Motion carries. Any business arising from the minutes today? Not seeing any. We will now move on to 8.2 as per our amended agenda, which is the direction request for the Sea to Sky Regional Hospital District administration fee increase. And we'll be doing this in advance of item 7, which is adopting our 2026 or considering our 2026 budget. And I'll pass it over to you.
Good morning, everyone. Colin Hodgins, Deputy Director of Finance. This report is just looking to increase the administration fee that is charged by the Sea to Sky Hospital District to the SLRD. In the past years, we've had an administration fee of $2,750, and this was meant to cover all the staff time and overhead costs of administering the financials and audit and all the staff time that's required for this organization. However, through some conversations, it appears as though there's going to be more work required by staff in coming years, not just in terms of financials, but in terms of advocacy and, just addressing some of the hospital needs and healthcare needs in the area. So we are looking to increase it to $20,000. That was included in the preliminary budget and is also included in the draft budget or the adoption report that is coming after this. I'll open up for any questions.
Thank you very much, Director Hodgins. And this is a follow-on from a previous board request to look into this to provide some additional capacity on the staff side. So I'll go to the board if there's any questions for staff. Yeah, Director Pettingill.
So what would this mean if because I think we have sort of seen some examples where other regional health districts are significantly expanding their role in buying property and leasing back to the health authority and so on. Would this amount here cover that sort of consideration investigation, or is that sort of something we would look at and budget for in a future year? More not necessarily doing it, but just sort of the work to understand, do we want to do it?
Yeah, good question. In the past, the staff capacity that's been put towards the Sea to Sky Hospital District has been pretty minimal, and we're in a bit of a transition phase where Vancouver Coastal Health and health authorities are looking to address some of the issues in Sea to Sky. So we are anticipating some increased workload. Specific projects in future years we would likely address through the budget each year. Like after this year, we'd analyze whether that 20,000 was accurate, and we might recommend a reduction if we didn't see that capacity increase that we anticipated. Or if we have additional projects on the horizon, then maybe we're looking to increase it further. Yeah, does that answer the question?
Yeah, I think it sort of means though we're committing, I guess, to not really going a huge distance in that respect, and maybe we don't want to, but that sort of wouldn't be in the work plan for the next year.
Thank you. Just to provide some clarity, this also reflects work that was done in prior years that hasn't been covered by the Regional Hospital District Board. For example, Harrow Road advocacy and a lot more work investigating those sort of things. So I'd also like to point out that the 2,750 is not a true reflection of staff time that has been put in. So it's also to offset what's been currently being charged to general governance. So just want to have some expectations there. The focus for this year will be the memorandum of understanding, and VCH has asked staff to start coming to the table more often, and that creates more work, and this covers it.
Director Herford.
I appreciate that context, my question was gonna be around like quantifying that. How much of this is that catch up where it's cost more than this to administer, like the baseline where we should be, and then how much of it is a step forward? Is it 50-50? Like that 10,000 is gets us to where the what it costs to administer what we have so far, and then 10,000 is that step forward, or is it? I mean, that's just a suggestion, but do we have you been tracking it that way? I didn't see it.
We don't track. Thank you. Thank you. Through the chair, we don't track in detail hours spent, but we are starting to. So like the $20,000 is an estimate that we are certain will cover what next year looks like and give us data for what the future years look like. That the MOU and perhaps more strategic planning on long-term visioning, partnered just internally with ourselves and with VCH would tell us a lot more. I would, if I had napkin math, I would say a third of that is already utilized by staff. So I think.
Yeah, I would think that that's fair. And as Heather said, that were 2750 was a flat fee, so we weren't actually allocating exact staff time. So what we do have isn't necessarily accurate, but as we move forward into this more like adding additional capacity, we'll track staff time and ensure all staff are tracking their time so we can have a number to present next time.
Thank you.
Any further questions for staff? There is a recommendation in the package and in our staff report that the annual administration fee charged to Sioux Sky Regional Hospital District by the SLRD be increased from 2,750 to 20,000 the 2026 annual Sioux Sky Regional Hospital District budget. Moved by Director Herford, seconded by Director Ford. Any comments? I'll just say I think that this is an important step in both like good governance for this board, as well as ensuring that we have some additional staff capacity to do the work that we know we need to do from an advocacy perspective. From an ongoing engagement perspective, a lot of that work has fallen to board chairs and vice chairs, who will continue to be involved, but doing kind of detailed work of wordsmithing MOUs and doing it back and forth with BCH, I think that sits better with staff capacity as opposed to political capacity. And so I think it makes good sense to be able to have an appropriate envelope to charge that back to the organization. So thanks to the staff for the work on this, and I will call the question. Any opposed? Motion carries. Thank you very much. With that, we will go back in our agenda and go to item 7.1, which is the request for decision on the 2026 budget. And we still have Mr. Hulchins here.
Yeah, so this is a report that's requesting adoption of the 2026 Sioux Sky Hospital District budget. There are some changes from the preliminary budget in that the BCH's 2026 ask has been added. The total amount of their ask was $1.473 million. And that was just the tax requisition amount is the same at a 3% increase, but that funding request was just moved from what we had as budget contingency into the actual projects that BCH has listed. It also includes the $20,000 administration fee that we just discussed. I'll open it up for any questions.
Any questions from the board? I have one, which is a holdover expenditure that we've been that we've had earmarked for a number of years now for BCH at the Squamish General Hospital replaced fluoroscopy unit. I just wonder if we've had any feedback from BCH on whether that project is still open and live or if it's been closed out.
I believe it's still open. And you? Yeah, I haven't got like a recent update from them.
Yeah.
But we usually do get notified if something's been closed out, but I can follow up with that. And if it is not needed, then we can remove it for 2027.
Yeah, it doesn't make or break our 2026 budget, but I think we're doing a better job of circling back and working with BCH to have them circle back with us when they do close out projects so that we can, their process is that they they invoice us last, so they use all their other funding and then they invoice the regional hospital district last. And so sometimes they close out projects on their end and forget to tell us about it. And so it sits on our budget for extended periods of time. Director Pettingill.
Yeah, just looking at the audit line, the forecast for 2025 is percentage-wise a decent chunk smaller than our budget. And then for 2026, we're increasing the budgeted amount by a fair bit. Is there something, are we planning a more substantial audit or a different sort of work, or I'm just curious as to why?
We have to go out for RFP this year. Our audit contract is ending, so we've just budgeted a contingency. As we can, those quotes will come in at.
Any other questions for other staff or your fellow board colleagues on our 2026 budget? Would anybody like to move the bylaw number 55/2026, cited as the Sea to Sky Regional Hospital District 2026 budget bylaw, be introduced for the first, second, and third time? Moved by Director Pettingill, seconded by Director Ford. Any comments? No comments? Thank you to staff for the work on pulling together our annual budget. I feel like this is a fairly streamlined process at this point, but an important one, and we're getting across the line in January, and it's not due till March. But that provides some further certainty to our partners as we work together to deliver important healthcare services like a CT scanner in Whistler, X-ray machines in Pemberton, CT scanner in Squamish, to be able to ensure that those funds are there for BCH to do the work that they need to do to deliver those projects for our communities. And hopefully we find a creative way to also continue to get that money out for Harrow Road. But we'll continue to work on that. So thanks to the board for supporting the work and for staff for making sure that all the I's are dotted and the T's are crossed on our annual budget. I will call the question. Any opposed? Motion carries unanimously. Thank you very much. And now we'll move to adopt the budget. So that bylaw number 55/2026, cited as Sea to Sky Regional Hospital District 2026 budget bylaw be adopted. Moved by Director Herford, seconded by Director Richmond. Any opposed? Motion carries. We are now on to item 8.1, which is the CEO verbal update.
Hi, everyone. Heather Paul, CEO, SLRD. Nothing to report today.
Thank you very much. We've already done 8.2. We're on to item 9.1, which is the chair's verbal report. And I just have two items for you today. A reflection that a few weeks ago on January 14th, MLA Jeremy Valeriot pulled together a forum which was very well represented with a diversity of folks around the table to start to discuss and brainstorm how we move forward on a new regional hospital for the Sea to Sky, likely based in Squamish. There were folks from Squamish Nation, from Lillooet, from VCH, the divisions of family practice, the various hospital foundations, local governments from across the corridor, all brought together for a 2-hour forum on just to better understand the process. I think there's some real key takeaways that at a minimum, it's a 10-year project. And we're at the very start of that. And it is an expensive project. So going back to our budget, it's important to ensure that we start to think about that in our long-term financial planning. But it was really great to see the enthusiasm in the room and the ability to understand where the potential roadblocks are going forward for this project that everybody agreed is a really high important project for the region as a whole. So grateful to MLA Valeriot for pulling that together. And he'll continue to champion, him and his office will continue to kind of champion the next steps out of that. And I will continue to work closely with him on that, unless I hear otherwise from the board. Any questions on that? There were other members around this table who were present. If anybody has anything else they'd like to add.
I wasn't there, but so this is to replace what it currently exists. It's not to increase the capacity of the current hotel. It's not a hotel. It's not to increase its current capacity. It's to replace a very, very aging, inefficient building.
That's correct. Replacement or expansion on the existing site, I understand, is not very feasible. And so they would be looking for a new site. It would be a new.
Okay.
So there were also a handful of landowners in the room, which is part of the puzzle, is making sure that there's an appropriate piece of land that could actually service a new hospital. And from all the requirements that BCH has, from hydro requirements, power requirements, access to the highway, air service and things like that. So there's some complexity in terms of siting and location factors.
Okay. I'm just concerned that we've put lots of money into increasing Hilltop House and growing some of the services there, orthopedic services have been invested in recently. I'm all for new and shiny, but at the same time, being realistic that it's difficult to staff the current hospitals within this province. We hear it all over that hospitals are closing on a regular basis. And so I don't want us to get the community's hopes up that we're going to build this Lionsgate State Hospital in a community that can't really grow in their service providers, healthcare the care workers, you name it. And so I think it's a really important discussion to have, but being very realistic about the state of healthcare province-wide. So
absolutely. And there was good discussion, I would say, as a yes and there is some really dire needs in the current system. And as I said, the new hospital project is a minimum of 10-year project at best. And so it doesn't mean that we don't invest in the system that we have. As we have done in our discussions with BCH today, be cautious about how we invest in that existing facility. So the CT scanner in Squamish, for example, is a portable unit. It can be moved. So they're already planning for that kind of flexibility in capital investment. And we still need to continue to advocate and push BCH for ongoing investment in the existing healthcare system to make sure that it is working, as well as thinking out for 10, 15 years from now. Director Pettingill and then Director Herford.
Yeah, just one tidbit that surprised me a little bit in the conversation was a claim, I think it was from VCH, that they don't have the staffing problems in Squamish, at least that they do in other places. Now, seeing the housing situation, it seemed a little bit surprising, that comment. So I have some skepticism there still, but it was interesting to hear. And I guess just going back to the earlier agenda item we had of increasing our budget, and I appreciate the work MLA Valerian is doing, and it's sort of in the back of my mind. I think it's been mentioned around this table at various times, and I appreciate our chair being involved in this discussion, but I do wonder if maybe this is something that this body should be taking on, is really the sort of leaders in the corridor on this, rather than our MLA, possibly, I'm not sure.
Director Herford.
Yeah, thank you. I found that we learned a lot at this, which I was actually surprised by, because there has been so much work happening with the Health Vision CT Sky work and so on. And a lot of it was actually through the active participation of BCH, which I think is quite remarkable and feels like a shift from since my time in as an elected official. And so I really wanted to just highlight that. There was a lot of what I felt like transparency around what their priorities are, where what the crux of these things, projects like this, where those pinch points are for them, and I think it was great to sort of bring everyone up to the same level of understanding of where we are in the complexity timelines, which you've heard about here. So I think without their active participation at like the CFO level, we wouldn't have got that out of that session. So just wanted to highlight that for everyone.
I agree. I think it was a good meeting. I think Director Herford sort of put his finger on what was different, which was participation in a serious way from BCH. I've seen that at other tables lately as well, which I think is a good sign. I do think that, I know, I left with some concern that we're going down the path of the Squamish Hospital outside the context of the rest of the Sea to Sky. And it seems to me like from this table's perspective, the Pemberton Clinic is a priority for us and we don't want to lose sight of that. And so maybe back to what Director Pettengill said, it would maybe make sense to have them back at this table to have that conversation here. Because I think we have determined that we are in a region that leans on other facilities throughout the corridor to do the work as a united whole. And if what this meeting was the beginning of was a focusing of that energy all on the replacement of the Squamish Hospital, I feel like we would be maybe doing damage to ourselves. So I'd like to bring it back into some sort of coordinated process with the whole region if we can.
I appreciate you raising that concern. I want to be very clear that I continue to say it's not an either or, like the Pemberton Clinic, I believe, is on the short to medium term list for VCH already. The Squamish General Hospital isn't even on the internal list for VCH. And so like that is even a process that, again, we're talking about 10+ years. So even to get Squamish General Hospital on the radar for VCH is a first step, whereas the Pemberton Clinic is on that list. It's articulated in their kind of short-term capital planning process. So I totally hear how do we make sure that this board is advocating for the big picture and all the pieces along the way. Our capacity is limited, the amount of time that we have and ability to focus energy is limited. But I don't want to have to pit one of these things against the other when the reality is if I think 15 years out, we will need both.
So I mentioned the Pemberton Clinic. There's also the Whistler Clinic.
Absolutely.
We close at 8 p.m. every night. I feel like if we're going down the path of sort of pushing forward to get on the list, the facilities in each of our communities, then we need to be doing things differently and they need to be doing things differently. And it's not the way we've been doing it. Now, granted, it hasn't worked the way we've been doing it, but certainly if we're pivoting to engaging VCH with our MLA on behalf of a project in Squamish, well, then it would seem to me Whistler better start doing the same kind of thing and having meetings in Whistler about where we're going, and Pemberton to be doing the same thing, and that just hasn't been the way that we've been doing.
I think, I guess the big part of the question is where VCH sees this kind of meeting fitting in their whole master planning process, right? I attended remotely and I could hear well when people were on this side of the room, but I really struggled on the other side of the room. It was tough. It was a big crowd, so. So I missed a lot of bits, but and like you say, if our VCH participated in, in a transparent way, but I was really curious, and whether I missed it or not, where they see this fits in. We had the wellness community or wellness village group do a big presentation as part of it, and that was interesting. But so you heard from all these different folks and the needs and all that, but I was really sitting there wondering, where does this all fit? How does this all fit back together? And really what we've been working towards with VCH is this master plan, which we have mixed feelings about to date in terms of the results we've gotten, but hopefully the capital plan that comes next will finally give us a bit of this roadmap as to, expansion in Pemberton, expansion, Whistler, new hospital, like just give a bit of that roadmap. So we have to understand a timeline, so we don't have to get into this sort of debate about it, right? Or curiosity about it. Do you know what I mean? Like, so I think maybe the next step would be to bring VCH back, or through your work as the chair to have that conversation with them and go, okay, so how do you interpret that meeting? Where does that fit into your planning picture? Because I think all the concerns or the thoughts are balanced.
Do you know the answer to that question? where this fits in their, like where that meeting fit in their master planning process?
So they I can't speak on behalf of
Well, yeah,
VCH. They participated as was spoken to, and quite actively. My understanding is that through the visioning process, all of those things have been identified as further needs. Where we continue to ask as this board for further clarity from VCH is like, what does that actually mean? Like they say that we need more healthcare services in each of our community across all 4 areas. They are now doing the work to articulate what that means in terms of increased hours of service at existing healthcare facilities versus new healthcare facilities. And they, from my understanding, they don't have that information. They haven't been able to provide it to us. So I do think that continues to be where we work with VCH, both through the working groups that we have established and then on their biannual presentations to the board to keep us up to speed on how we work in tandem to ensure that there is a bigger vision than just a one-off ask here and there. I agree that that has long been the direction of this board for the last handful of years, and I don't think we're choosing to abandon that. I think we continue to push VCH on getting clearer on their capital planning process so that we know how we can show up as a funding partner. Your turn, Bert.
Yeah, I think going into it, I had that question of where does this fit into the VCH piece? And I think it is an important distinction where it wasn't a VCH organized or led event. And it was, I think, likely put together in response to community interest or as people come to, I know when people come to me as an elected official with healthcare concerns, I talk about the work of this group, but also politely point them towards the province and their provincial representative. And I think that, I mean, that was the driver to have this thing. I don't think it was, meant to try to short circuit any process or derail any of the other pieces of work that we have going, but perhaps is a symptom of that master planning process not being as far down the line and not getting that information out. So I thought it was an interesting piece, but it was a total aside to the process for VCH in my opinion. So that's why I was so surprised it was productive when we got there.
Any other questions or comments?
I would suggest that part of the review that the province has commissioned to have all of the health authorities reevaluated, and some of the findings that have come out in just recent weeks, is likely part of why they put lots of ideas out there, and not because they're seeing what sticks, but they've heard from communities in all of these different processes that these are the demands from our community. We see an aging population, we see aging infrastructure, we see, just a lack of care, or challenges in care. And so, they're also trying to do this review to streamline and make it more efficient. And so they may be waiting for that review to be fully unveiled before they go ahead with, like they're talking 1,100 administrative positions to be cut through the health ministry. So that's a significant number of planners. So anyway, I think more will be revealed as this comes out. And we have done the work as this board over the last several years to be ready with healthy reserves and with a really strong fiscal policy where we're always understanding what the next thing is. We've had really good relationships built so that we can be in front of these asks, and we have strong relationships with the health foundations in the corridor. So I think we've done everything that we could possibly do as a board, and I'm sure it's going to pay off. Thank you.
I think that leads in well to my next update, which was around continuing to build important relationships. We were able to host Minister Josie Osborne through the corridor yesterday, both for an exciting announcement as well as just to showcase some of the amazing innovation and alternative models that are being deployed throughout the Sea to Sky in order to ensure that people have the healthcare that they need in the places that they need it. I'm going to turn it over to Vice Chair Mike Richmond on the announcement component.
Okay, thanks. Yeah, no, it was good fun. Minister Osborne and her team were here, and Jeremy was here as well, and a number of other folks, and we were able to announce the satellite funding for Foundry. It's nice to be able to go public with that. It was a really nice ceremony out there, and a lot of providers and a lot of people that are involved in the process up to now were there. So it was really. I mean, we've kind of known for a little bit now that this was coming, and we've been excited to share with the public. So it was a great afternoon. Maxine and Roxanne were there to do a welcome and share some really nice words, and yeah, all around a good afternoon. And also had the opportunity to tour with Minister Osborne through the Pemberton Clinic and highlight all of it. Didn't take too long, and just show, show some of those needs we were talking about in the previous discussion locally. So it was really good to have her have eyes on the place, I think, and meet some of our staff there. So yeah.
Absolutely.
Thank you.
And then she went down to Whistler and you had a chance to showcase Whistler 360.
Yeah, she started with us in the morning, meeting our board and many of our senior leaders within our trauma center. And so we shared with her how the Whistler 360 Healthcare Nonprofit Society was formed and what we've been able to accomplish, how we arrived at what we knew. And we are incredibly proud of the team that we've got. Many of the family physicians shared their personal stories of having worked in the model before and then now what it's like for them. And they're calling high morale for the last 3 years and ongoing high morale, no burnout, no turnovers amongst our staff. There's a real stability amongst our teams, and all of our community is attached to a family doctor if they want to be. And we still have capacity to attach more patients to family doctors, it's surprising and it's not the story anywhere else. And so they were really interested in how did we do it and how can they replicate it and what can be scalable in other communities. So it's a little humble brag.
Absolutely.
Yeah.
And we were able to welcome her down into Squamish and showcase the Open Door Health Clinic that is based under one roof, which has also been able to attach about 350 complex patients with primary care support right at the shelter. So meeting folks again where they are at. And then also had a chance to show her the overdose prevention site. So just a real hub of acute care support for our most vulnerable folks in the corridor at the south end of town. And so I think, as I said to Minister yesterday, just so thankful for her to continue to show up in community and really see firsthand what it's like throughout the corridor. She was surprised by the diversity of the Sea to Sky region. And the varying innovative approaches that we've taken to be able to, again, meet people where they're at with the healthcare that they need. And so it was great to have her in the corridor yesterday. That is my verbal report. Any questions? Any further comments? Motion to receive the report. Moved by Director Ford, second by Director Mack. Any opposed? Motion carries. Is there any late business that anybody would like to bring up today? Not seeing any. Director's notice of motion. Also not seeing anything. I'll have a motion to adjourn the meeting, please. Moved by Director Ford, second by Director Mack. Any opposed? Motion carries. Thank you very much, everybody.
Thanks for your leadership.